are Carboprost Tometramol. We are also known as a brand name Evaprost, made in the Philippines by Multicare.
My therapeutic drug classification is oxytocic, and my pharmacological classification is prostaglandin.
I belong to the pregnancy category C because of the teratogenic effect.
I stimulate the gravigerous myometrial contractions at the end of the full-term pregnancy. I also stimulate the GI tract that causes vomiting, diarrhea, or both, which is common in terminating pregnancy. For postpartum, I act to evacuate the products of conception from the uterus out of the body. As a result of myometrial contractions, hemostasis occur at the site of the placentation. In large doses, I can raise blood pressure, probably because of the containing vascular muscles.
I can get through your body via intramuscular injection, and I will be on my peak action 20 to 30 minutes after administration, acting on your myometrium. My half-life reaches only 3 hours that will be metabolized by the lungs and liver via beta-oxidation. Then, my metabolites will go out through urine excretion.
I treat postpartum hemorrhage due to uterine atomy that hasn't responded to the conventional methods of management.
Don't administer me with patients that has benzyl alcohol hypersensitivity, acute pelvic inflammatory disease, women that undergo cesarean section, patients that has chorioamnionitis, cardiac disease or hypertension, asthma or pulmonary disease, and lastly, patients with anemia, diabetes mellitus, hepatic disease, jaundice, renal disease, and seizure disorder.
I have side and adverse effects on different body system, reproductive system, retained placental fragment, breast tenderness, perforated uterus, uterine circulation, and uterine rupture. If it is used for abortion, endometritis, retained placental fragments, and excessive uterine bleeding. In cardiovascular system, we have fatal hypertension, tachypnea, pyrexia, myocardial infarction, convulsion, and ECG changes. In urinary system, we have urinary tract infection. In digestive system, we have vomiting and diarrhea.
Nurse administer me to the patient. He or she should assess the mentioned concussions and contraindications to prevent further complications. He or she should perform a thorough physical assessment to have a baseline data before administering me to determine the effectiveness of the therapy and to evaluate any drug adverse effects. Then, he or she should monitor laboratory test results to evaluate the hematological studies.
The time you administer me, your responsibility is to ensure the fetal position and cephalopelvic proportion, to regulate oxytocin delivery using an infusion pump between contractions if it is given to stimulate labor to regulate appropriately, to monitor blood pressure and fetal heart frequently, to monitor adverse effects, to monitor tone and involution and amount of bleeding, to provide comfort measures to help patient tolerate the drug effects, and to educate the client on drug therapy.
Then lastly, after you administer me to the patient, you should monitor the patient's response to the drug, such as uterine contraction, prevention of hemorrhage, and milk letdown. Then, the nurse should monitor the adverse effects, such as blood pressure effects, uterine hypertonicity, water intoxication, and ergotism. Then, evaluate the patient's understanding of the drug therapy by stating the drug name, indication, and the adverse effects to look for. Lastly, monitor the patient's drug compliance.
A friendly reminder to you, know me better for a safer administration.